Just a few minutes ago, the CDC posted surprising new data on e-cigarette and tobacco use among U.S. teens. Electronic cigarette use among U.S. middle and high school students tripled in 2014, while smoking of conventional cigarettes fell by nearly 25%. How does this new information change the regulatory equation? Is this cause for alarm that youngsters are taking up the new devices so rapidly, or a new sign that e-cigarette use can reduce tobacco consumption? So that just came in interesting and relevant to our discussion.
Well, I would start by saying that's not surprising news. We know the rates are going up dramatically among young people, and so this just confirms that trend. So it's accelerating. There's also a very important report from Monitoring the Future last year saying that among high school students, more high school students are now trying e-cigarettes in the last month as opposed to traditional cigarettes. So this just underscores the urgency of getting our arms around this problem, getting the regulation process going, both federally and also accelerating at the state and local level, and then doing that in a informed manner with the best research. So if this can be used as a form of harm reduction, we can get there sooner rather than later, and put that all within the context of this very important global conversation on how to accelerate tobacco control.
Scott, can I chime in?
Yeah, go ahead, Ken.
Yeah, Howard started out saying exactly what I was thinking. This isn't surprising because the data from Monitoring the Future have indeed shown us the same thing. The new data demonstrates something absolutely fascinating. The decrease in smoking among the kids surveyed in 2014, when we saw this huge jump in e-cigarettes, was the largest within memory. If you look at the fact, we've been seeing declining smoking among kids year after year for a long number of years now. Last year was the biggest one we've perhaps ever seen in terms of percentage points. I don't know what that means, but the questioner has something we need to ask ourselves. Is there some sort of substitution going on? Are people who would have been smokers or were smoking, are they kids? Are they substituting e-cigarettes for that? And then Dave's point is really a critical one as well. Is this something of a fad, or is this going to become a long-term sustained trend? So there's many questions raised by these data as there are answers, and we don't know whether this is a good, bad, or indifferent thing at this stage.